So, hi dear students. Today in this session we'll be dealing with this moving, lifting, transferring and turning. How to do this procedures to our patients. So first we can see moving an object to a new location. So while doing any objects, not a patient, while moving anything during our work schedule, how we have to do and how what posture we have to maintain and based on what body mechanics we have to carry out. So the object will be moved from a waist high area to lower area 5 to 10 feet away. The procedure will combine all the rules of body mechanics. So first thing we have to keeping in mind all the rules of body mechanics that we should be remembered while doing. And for this, some of the nurse's responsibilities are there. This is first thing, we have to identify the object to be moved and we have to adopt a stable base of support. That is, our feet should be separated and one foot should be behind other one and our back should be straight. Otherwise, we will be getting body aches, back aches, pain, etc. Then we have to grasp the object at its approximate center of gravity. Otherwise, we will feel an extra weight to that particular object while lifting or moving. Pull the object towards your body center of gravity using your arms and leg muscles. So these are the strongest muscles. So by using these muscles, we have to push or we have to pull this particular object towards our body center of gravity. Then it will be more easier for us to move the object. Then we have to re-establish your base of support and appropriate body alignment. And again, our back should be straight. We should have a stable base of support, and we are holding the object approximately at waist height and close to our body. We had to pivot towards the desired direction of travel, turn on both feet at the same time, and maintain a stable balance. We had to re-establish a stable base of support and appropriate body alignment. Again, our um, uh, back is straight, feet are apart, and one slightly behind the other, and the object is at hip level close to our body. And this thing we have to keeping in mind while moving. Then squat and place the object onto the lower area. So in this case, we have to bend at the knees and hip, maintain a straight back, maintain a stable base of support, use your arm and leg muscles as needed for guidance, and we have to use our leg muscles to resume an upright position. These are very easy to understand. That is, while moving a particular object from different heights and different position, what all things we have to keeping in mind and how our body posture and body mechanics have to be maintained. These are the things we have discussed here. Now, regarding turning the patient, while turning a patient, what things we have to keeping in mind? Like um, general principles of turning the adult patient that have to be keeping in mind. And in that, the first one, a schedule can be set up for turning the adult patient throughout his awake hours. That is, if you are when you will be starting your posting in the clinics and all, especially in ICU, but sometimes not sometimes, it must be routinely practiced in our ward area, especially the patients who are immobilized or neurological deficits, patients with neurological deficits and all, they will be doing this thing. That is, for every mobile patient or unconscious patient, we have to schedule a position changing as per the that is 2 hourly changing and 2 hour turning that have to be maintained based on a particular schedule. So that must be maintained. The patient should be rotated through 4 positions unless a particular position is contraindicated. That is, if any of the position is contraindicated, means we should not go for that position. Otherwise, we can have these 4 positions like prone, supine, left sims, right sims. This is must. So these 4 positions must be provided to the patient in a particular manner or schedule so that the uh, can uh, turning can be done and several complications can be prevented. and we had to plan a schedule and follow it. For this positioning, we had to plan for a schedule, and followed by that we had to carry out it, and record the position change each time to ensure that all position are used. So for 2 hour, in the 2 hourly basis, we have to provide each position, and at the same time we have to record that also. That is, for example, if at 10 a.m. if the patient is in prone, at 12 p.m. patient will be in supine, at 2 p.m. patient will be in left sims, at 4 p.m. patient will be in right sims, etc. So this is the way we had to document it. And again, notice that in proceeding sequence, the patient is required to make only a quarter turn rather than a half turn each time the position is changed. If the patient experiences pain while turning, a quarter turn will be less painful than half turn. So what here explains is uh, a full turn or a half turn. When a half turn is very difficult for the patient, it can be painful. So a quarter turn can be done to them. Certain conditions that may take it impossible to turn the patients, like if any fracture is there or any weakness on particular side. So in that cases, we can't turn the patient to particular side. Turning may be impossible if the patient has fractures that require traction appliances, that we have already done. Turning may be harmful to patients with spinal injuries. In these cases, you need to rub the back by lifting the patient slightly off the bed and massaging with your hand held flat. So, in case of any spinal injuries and all, the turning might not be possible. Okay. And it is especially important to prevent skin breakdown in the person who lies on his back for long period of time for the initial development of skin breakdown. A patient does not have to lie on his back for long period of time, especially if moisture and sheet wrinkles are present. That means if a patient is, we all know, if the patient is not moving and he is continuously lying on his back, that is in supine position, there is a high risk for getting pressure ulcers like skin breakdown can occur. So that must be prevented by the nurses. That is one of the major nurses' responsibility. And while maintaining a particular position, we have to prevent this wrinkles in the bed or the sheet, and moisture present in the sheet. You may want to turn a patient only to wash or rub the back or change the bed. Now, this is log rolling. This is a particular supporting device, and a method to turn the patient. So, it is a technique used to turn the patient whose body must at all times be kept in a straight alignment. Okay. And this technique is used for the patient who has a spinal injury. Log rolling is used for the patient who must be turned in one movement without twisting. That is, from the head up to toe, that must be turned in a one position or a one movement without any turning or flexion, etc., because the patients are suspected to have the spinal injury. So in such cases, the body turning should be done through a straight line. So for that we are using this log rolling. Okay. It requires two people, or if the patient is tall, then three people. Two or three people according to height of the patient. So while doing uh, log rolling techniques. So this can be seen in our next session. Okay. In next link, we can have this techniques of log rolling.